audience analysis, I was able to discover that many of you have your own personal ties and experiences with eating disorders. One of you even said, "I went through years of eating disorder treatment myself." Unfortunately, this isn't uncommon, and many people are struggling with eating disorders, and none of us would even know. Take a look around the room. None of these people look like they have eating disorders, right? But throughout my speech, I hope to persuade you to become more aware of eating disorders and the individuals struggling. I will prove how little they're talked about while exploring the different treatment options and offering various ways to spread more awareness. In my last speech, I informed you all of the different types of eating disorders, but I don't really expect you to remember that. So we'll go through what they are again. To make things simple, since we're just trying to bring awareness, I'm only going to focus on the two more common ones. There are many different types, but the first one we're going to be talking about is anorexia nervosa, and the other one is bulimia nervosa, or more commonly known as anorexia and bulimia. Anorexia is an eating disorder in which affects a person's food intake. Someone who has anorexia will be seen as starving themselves, and according to Prevention of Disordered Eating Among Adolescents, an article written by Marilyn S. Macy Stokes, the official criteria needed to meet in order to be officially diagnosed with anorexia include a refusal to maintain a healthy body weight, denial of your current low body weight, and missing, for women, 3 consecutive menstrual cycles. Bulimia is the other one, and it also affects a person's food intake, but in a little bit of a different way. Patients with bulimia will go through episodes of binging, meaning they'll eat whatever they want, whenever they want, then later compensate for that behavior by either purging or throwing up. In an article written by Elaine Yukowitz titled "Bulimia: Growing Awareness of an Eating Disorder," the criteria for bulimia is having those recurrent binge episodes and then also compensatory behaviors, and that cycle has to be happening at least 2 or more times a week in order for it to be considered bulimia. As I mentioned before, many people struggle with their relationship to food and the way their body looks. Lack of awareness and information offered surrounding these serious disorders is truly upsetting. In an article written by a child psychiatrist, Nadia McCauley, titled "What's Weighing Us Down? Closing the Gap Between the Global Burden of Eating Disorders and Their Representation," she states, "Eating disorders are common psychiatric disorders that affect every 1 in 10 individuals. Despite their prevalence, eating disorders remain far below any other psychiatric disorders in relation to papers published and research funding." She goes on to unpack a study conducted recently where they took eating disorders and other disorders and disabilities and compared them to each other. And shockingly, eating disorders had the second highest in absolute increase, meaning that more people now have eating disorders than they did before, compared to like depression and anxiety and all those other disabilities and disorders. It's gotten so bad that the mental health disorder, this is the only mental health disorder that associates with mortality in kids. Before eating disorders became so serious, a mental disorder taking someone's life was almost unheard of until eating disorders became so prominent and problematic in today's society. While they are becoming more serious, there are still forms of treatment being offered. In my audience analysis, multiple of you were curious to learn more about the different types of treatment options offered to patients struggling. Although I already went through them in my last one, I'll go through them again. But it's hard to narrow it down to just a few options when they all look different depending on the individual and what they're struggling with. But in the article titled "Traditional versus Virtual Partial Hospital Programs for Eating Disorders, Feasibility and Preliminary Comparison of Effects," they do a good job at breaking it down into multiple easier options, including medication, family-based therapy, inpatient treatment, and outpatient treatment. The medications are usually only found to be helpful when you're dealing with bulimia, and the medicines are usually used are antidepressants, antiepileptic medications, anti-obesity, and stimulant medications. While different medications have been found to treat these disorders, there's almost no medications found to be helpful when we're talking about anorexic patients. Fortunately, family-based therapy has been proven to be helpful among most to all anorexic patients. This therapy is focused on addressing the issues caused within the family believed to associate to the patient's eating disorder. This isn't to place blame on the family by any means, it's just to understand where this unhealthy idea of what they need to look like is coming from. Another option is inpatient treatment, like I said, and this is only used when the patient is seriously ill and needs special medical attention. They're usually treated through these feeding tubes called nasogastric tubes, which go in through your nose, down through your throat, and into your stomach. And it sounds uncomfortable, but like I said last time, all the patients report to feel better, having less stomach pain, and end up to having a faster, smoother recovery. The last option for patients struggling with either disorder is called outpatient treatment. Patients will be assigned a nutritionist in order to help set up a plan to meet their caloric intake and nutritional goals. This usually includes video calls, texting, or other forms of online communication, and unfortunately, it was the only one that became available when COVID hit. Every patient was forced to go to outpatient treatment, even if that's what worked for them or not. And that definitely took a toll on the patient's recovery and how many patients ended up struggling altogether. But as I mentioned many times before, eating disorders are not talked about enough. It's important that we bring more awareness to these disorders and make sure that they're talked about more. As stated by Katie M. O'Brien in the article, Predictors and Long-Term Health Outcomes of Eating Disorders, Anorexia and Bulimia may have long-term effects on overall and reproductive health. It's kind of sad to think about that girls and women are so interested in looking skinny and looking a certain way that they would risk their ability to bring a life into the world. But it happens all the time. It's pretty scary to think about. Clearly something needs to be done, but what? In an article titled Eating Disorder Intervention, Prevention, and Treatment, Recommendations for School Counselors, the author Angela D. Bardick goes on to a deep dive of different suggestions to spread awareness. School counselors obviously play a vital role in prevention and early identification of eating disorders. Sorry. She says that one of the best things that we could do is create a new program for these students that are struggling, which would be an eating disorder prevention program. And this would basically be where we would stick all the kids in a classroom that, not an actual classroom, but a classroom that has like different accommodations for different kids, and they would be told about the serious, dangerous effects of these eating disorders, because clearly we weren't told that in school. I was never told how serious these disorders could be until I researched them on my own. It's really important for kids to know what could happen, and it would also help them develop critical thinking against the glorification of thinness, and it would stop growing that unhealthy stigma surrounded by the way our bodies are supposed to look. Another small way, this isn't a huge deal, but I've noticed that teachers, parents, and even us with our younger siblings, we're always talking about our bodies, and it just doesn't need to happen in a negative or positive light. Kids are becoming more aware of their bodies way before they need to. It doesn't need to happen. And I know more often than not, we'll hear our parents or our teachers say, oh, I look fat, or I can't wear this because it doesn't look good. And that just gives such a negative mindset to the kids that are listening and looking up to us. But in my persuasive speech, I told you what eating disorders were along with the treatment options, while offering my best solution to spreading more awareness. For the few of you who talked about your personal struggles in my audience analysis, you are not alone and can help others just like you by spreading even just a little bit of awareness. Thank you for listening to my speech.